Hi, this is Congressman Tom Cole, 4th District of Oklahoma, and this is another one of our weekly chats. Let me start off by saying we're actually doing it in a rather unusual room. This isn't the normal personal office setting. This is actually the Minority Rules office, and the room in which I'm sitting was the original visitor's entrance to the United States Capitol. And someday we'll give you a tour of it. It's a very interesting room. The important thing to remember is this is the room, and there's a door in it, that the British penetrated the Capitol in August of 1814 and burned it down. So it's a quite remarkable place to get to reflect on Congress and the country and what's going on. This week there's only been one real topic that Congress has been focused on, and that's the emerging threat of the coronavirus and its spread. In Congress we've actually had a couple of hearings in the Appropriations Committee, one of which with Secretary Azar, the Secretary for Health and Human Services, clearly the most important single agency involved in dealing with this, though not the only one. We talked both about his budget request for the year, but a lot of the discussion was consumed over coronavirus because underneath the secretaries, or within the secretary's portfolio, he has the National Institutes of Health, he has the Center for Disease Control, he has the Strategic Stockpile, which is where we put reserve medical equipment, and he also, within Center for Disease Control, administers what's called the Infectious Disease Rapid Response Fund, something I set up a couple of years ago when I was chairman of this particular appropriations subcommittee. And there's a lot of contention about coronavirus, but I think the first thing you need to know, and I think the Secretary made clear, is number one, the risk to the American public is still comparatively low. We have fewer than 60 cases in the United States. We only have one so far that we can't trace directly back to China. But the reality is things are likely to get worse before they get better. We've had outbreaks in Italy, outbreaks in South Korea, outbreaks in Iran, lots of other countries with scattered cases, but major outbreaks in those three. So that tells us that the disease, the virus, is actually moving and being transmitted. And when you all of a sudden have multiple countries that have multiple sets of visitors to the United States, then the odds of it spreading here are much enhanced. Now, again, our officials have done a really good job. I have to give the president a lot of credit here. He was the first one that ordered travel restrictions and quarantines. He was wise to do so. That's buying us additional time. He also set in motion the considerable apparatus that we have at our disposal to deal with these kinds of problems. In that regard, I have to give Congress a lot of credit, and frankly, Republicans and Democrats, but particularly Republicans over the last few years. The National Institute of Health budget's been expanded by almost 40%, precisely because we were concerned about these kind of outbreaks and incidents. We've had Ebola, we've had SARS, we've had MERS, and we've had Zika. So there's been a real concerted effort to beef up the institutions that develop the diagnostics, the therapeutics, and ultimately the vaccines that protect the American people and frankly people all over the world. So we have a very good record in that regard, and we're probably better prepared than we've ever been in the past to actually deal with one of these situations. And I also think the administration, you have to build the tools and the institutions, but then you have to use them swiftly, and that's being done. I mean, right now we have the ability to test for the coronavirus so we can establish who has it, who doesn't, because it's awfully difficult to tell, and particularly in the early stages, the difference between it and the flu or really bad respiratory infection of any kind. So we think we've got that part of the problem licked. We're producing more and more test kits, so places are available to places have the tools available to quickly tell whether or not they've got a problem. Second, you got to figure out how to treat the disease. That is what are the therapeutics that's underway. A lot of the things you can do, frankly, to protect yourself are exactly the same things you do in case of the flu. Wash your hands a lot. Make sure that if you cough, you're around people that cough, that they use a handkerchief or they cough into their sleeve. Be very careful about that, and be a little bit cautious about large crowds. Although again, right now we don't have the kind of problem in America that they certainly have in China, but even in places like South Korea, Italy, and Iran. And finally, vaccine, and we're making good progress on that. We'll have tests within 90 days, less than that, probably within the next 6 weeks now. But remember, those are only tests. You don't get a vaccine the first time you test it. There have to be multiple clinical trials. So in terms of a vaccine, we're probably a year to a year and a half away. That doesn't mean we're without defenses. The public health system itself is a defense, but we ultimately want to get to a vaccine because this is like the flu. It might be the kind of thing that we don't just see once, but becomes recurring and is around for a long time. Bottom line, though, I think to date we've responded very well. Now, I think Congress will, in the next 2 to 3 weeks, give the administration supplemental funds. The administration has made a request for an additional $2.5 billion. They will clearly get that. I suspect they will get more than that. And indeed, the president said, look, we are happy to work with the Congress and take whatever money that they think we need. And I think that's been basically the attitude. We want the professionals, not the politicians, but the professional healthcare people to decide what needs to get done. And we need to make sure that they always have the available funds to do that. The president announced this week that he's putting Vice President Pence in charge of the coronavirus effort. That's a good idea. The Vice President, number one, that position's been recommended to do this in the past. It was actually a blue ribbon study by former Senator Joe Lieberman and former Governor and Homeland Secretary Thomas Ridge that recommended. That's where we lodged this authority, because the Vice President speaks for the President, can cut across all jurisdictional lines. I'm happy to see that the Vice President's already brought in, as part of his team, a noted scientist who's had the global AIDS effort, frankly, under the Obama administration. This is obviously not something that needs to be partisan. This is something that needs to be professional. I think that's the way the President has proceeded. Last point, we'll have some people here that try to capitalize on this and try to exploit it politically. That's a mistake. Frankly, we need to remember as Americans, nobody in America had anything to do with this starting. This started in China. It's a natural outbreak. There's no evidence at all that this is deliberate on the part of the Chinese. My goodness, 97% of the deaths so far have been in China. And over 2/3 of the actual cases have been in China. So clearly this is not something that they deliberately did, but it did break out there. They were slow to share the information, although faster than a previous incident, and they still have not been completely forthcoming in allowing our top scientists and medical professionals to have access to the scene of the outbreak. We think that would help us develop countermeasures a lot more quickly. Be that as it may, we've still responded well. As I said, we're in a position to continue to respond well because we've made the right investments for years, and now Congress has signaled and the administration signaled we're going to spend the money that it takes to develop the countermeasures, make sure that we have adequate resources for our local healthcare providers, and we're going to be very transparent about this so the public knows what's happening at every moment. To that end, by the way, we've already had four or five all congressional briefs. That is, the top scientists from the Center for Disease Control and the National Institute of Health and top professionals in the other agencies of government have come in to brief Congress. I conducted one of those briefings with my Democratic counterpart, Congresswoman Rosa DeLore, today. And I think those briefings will continue coming. We're having hearings, so I think there'll be lots of avenues for you to get current information. If you have any concerns, just go to the website for the Center for Disease Control, and we'll try to post that on our own website. But you can get a lot of questions answered there. They have an 800 hotline number, but you can literally track what's happening there and get the most reliable news. I also think the media is going to be covering this appropriately and keeping you well informed. So again, Congress is often divided and sometimes slow to act. In this case, while there's some sniping around the edges, I think you'll find Congress is united quickly in giving the administration the resources that it needs. And the reality is the focus is certainly there. People aren't ignoring the problem at all, either our top professionals or the Congress, certainly not the President and the administration. They've been laser focused on doing everything they can to protect the American people in a national health care crisis. So with that, I look forward to visiting with you again next week. I'm sure there'll be other matters to talk about, but we'll be keeping an eye on this coronavirus issue for a long time. As the ranking Republican member on the Labor, Health and Human Services and Education Committee, I'll be pretty deeply involved, I already have been, in determining the financial element of the response and in making sure that the appropriate agencies of government are funded and focused and positioned to protect the American people. I think we've done that pretty well to date. That's why there's only a few dozen cases in the United States, and we'll continue to do that. But I do want to tell you that, again, things will get worse before they get better. We have not seen the end of this, but we'll still, sadly, probably lose more people to the flu this year than we do to coronavirus. Matter of fact, we already have. So just keep that in mind. Take the same precautions you would take to protect you from the flu. Probably the best thing you can do right now to protect yourself from coronavirus. So with that, have a good week. I look forward to visiting with you next week.